Welcome back. It's just gone 1 minute after 9 o'clock, and a reminder that this hour of News and Views is sponsored by African Muslims Agency. African Muslims Agency, a beacon of hope to communities for over 35 years in Africa and beyond. Our next guest is standing by. She is Siphokazi Mtshizana. She is the MSF Community Health Educator, and we're going to be looking at non-communicable disease education in the Eastern Cape's rural heartland. Siphokazi, I do hope I've said your surname correctly. Good morning. Welcome to the program. Siphokazi, are you there? Hello? Hello. Can you hear me? Your picture is amazing. Good morning. Welcome.
Thank you so much. I hear you clearly now.
Okay, let's understand what is this diabetes screening event being held in Mbashe in the Eastern Cape's rural heartland, and why is it necessary?
Okay, thank you so much. As
Okay, we're going to have to take a break there. I can't hear Siphokazi. Can I ask you to remove your headphones, please? That might be creating a
okay,
problem. Can you hear me now? Welcome back. Can you hear me?
you.
Can you hear me now?
Yes.
Would you like to
Do you
respond
hear
to my
me
first
too?
question? I can hear you now. Please
Yeah.
respond to my question, please.
Yes. Hello. Can you please repeat the question?
What is the reason for the rollout of the diabetes screening event in the Eastern Cape's rural heartland?
Okay, thank you so much. That day was very important to us. We commemorated a World Diabetes Day in Vital because diabetes affects millions of people globally, and the prevalence of this disease is rising. Raising awareness help educate people on the risk, prevention methods, and management strategies, ultimately leading to earlier diagnosis, better care, and provide health outcomes. It also encourages governments and organizations to prioritize care and improve health outcomes for diabetes people and do research and give them a full information about the diabetes diseases.
How did the community respond to this awareness drive?
Our community responded very well because what we did was very important to them to take care of them and show that people that are living with a diabetes disease is in a priority place and people really need the care, more special in the community. People are suffering because the distance they traveled to go to reach the clinic are very far, and the poor support from the clinic is not good. And even as we do give them a more support by giving them a health education and doing activities like yoga and like other exercises that they will keep them very active and we do not allow them to go and drop the medication because of the distance they travel to go to reach their medication. We support them and give the medication closer to them, and as well as a healthy education.
So as an MSF community health educator, what does MSF stand for, number one? And number two, where else are you going to go with this awareness campaign?
MSF in Eastern Cape is a project that deals with NCDs, diseases like diabetes and hypertension, as well as mental health. So as MSF here, we provide e-health education and we promote e-pickup points in the communities, whereby the clinics of the OH as well as the committee members of that particular village come together and work together to build the pickup points, whereby the medication will be taken as a pack from the clinic and take the medication to the community where is the pickup point is, so that everyone who do not have a money to go and travel to pick the medication can go closer in the pickup point and take the medication. And we go there for a healthy education to treat the patient that are no longer go to the clinic because the age and the level of poverty, they can't go to the clinic because the distance is very far and the money is the problem, and those people are suffering a lot. It's where the MSF go there and teach the people and give them a medication closer to them and give them a support as well as activities and promoting a healthy lifestyle like a diet and exercises.
Okay, tell me, what does MSF stand for? What does it mean? What does MSF mean?
MSF stands for Doctors Without Borders. When we translate it to English words, it's a Doctors Without Borders project.
Okay, wonderful. We have spoken with them many times in the past. Thank you indeed. Keep up the good work. Until the next time. God bless.
Thank you so much.
It is 8:09. We are now going to be talking with Dr. Firoza Amin. She is the South African healthcare workers. She's with South African Healthcare Workers for Palestine. We're going to be looking at that story where they are, this organization and a whole host of other organizations are up in arms against Discovery Health. They wanting Discovery Health to withdraw from the 2024 Leadership Summit. And this is because Discovery Health obviously has ties to apartheid Israel. So that story is coming up next. Do stay with us. Lots more coming up in this hour of news and views on Salam Media. Not forgetting our Fired Up series with Dr. Hafiz Imran Chunara.
We are here in the middle of a Zahra neighborhood. The whole neighborhood is already destroyed. More than 17 towers are down. Here, as you can see, the firefighters trying their best to help. The people are still under the rubble. A lot of the people.
Join Hamza on his exclusive South African tour as he shares his personal experiences, never before seen footage, and powerful insights on the ongoing genocide in Gaza. This is more than just a talk. It's an invitation to witness Gaza through the lens of Hamza Sha'alan. Don't miss this opportunity to meet the photojournalist who brought Gaza's pain and perseverance to the world in its darkest moments. Follow Salam Media on social media pages for more on this tour and be part of the conversation.